So today I had to experience healthcare in Kuwait today.
Foodies in Kuwait, testing out the healthcare for her throat scare. These dogs will make you feel brand new in a fancy waiting room. Hi guys, I am sorry for the singing, promise no more. My name is Kidneyjay. The J stands for jerk because my kidneys are a pair of jerks. And today we're looking at Foodie Beauty's video titled Healthcare in a Foreign Country. And the only reason I'm doing this is because she makes a lot of comparisons to the Canadian healthcare system, or we'll say it's socialized medicine, if you will, compared to her easy breezy Kuwaiti experience. Before I do get started, if you're new here, hit subscribe, comment if you want, and leave a like, and let's hear what she has to say.
I get questions a lot about what if you need healthcare there, and I never really thought about that until it happened.
So that right off the bat is astounding to me. Those of you who followed Foodie Beauty know her history of pulmonary embolisms, was diagnosed diabetic once. That sort of went away. Of course, morbidly obese. She has asthma issues, breathing issues. So it's not like if, it's when she would need health care in Kuwait.
I've been really sick for the past few days. Just really fatigue. Not really congestion, but a bad kind of dryish cough and just shortness of breath, trouble breathing. It felt to me more asthma related, which I do have asthma.
So listen to her words there. It felt to me more asthma related. More asthma related compared to what? A pulmonary embolism? So I'm guessing she went to this doctor, did not mention any history of pulmonary embolisms because she knew if she did, it would not be as inexpensive as she goes on to describe. They would probably want a chest x-ray. They would probably want a D-dimer, which would mark if she had any blood clots recently. As well, she flew. She had a long flight from Canada to Kuwait, which increases your risk of DVT, which is like a blood clot in the leg, as well as pulmonary embolism. And of course, if you have a history of it before, your chances of getting another one are increased. And I'm not talking out of my ass. I do know this because I have had a pulmonary embolism in the past. So just want to say that.
And I do take inhalers for that as well, as you know, this morning. And I was having hard time breathing. After I made breakfast, I thought I'd see how it would go. I took my inhalers.
Sorry, my point is she did not mention that to the doctor because the cost would be a lot more. Now, if she were in Canada, which we saw, I think, less than a year ago. When was she? I think she did the ERBs before her Cuba trip last year. And she said they did all those testings because of her history of pulmonary embolisms.
I've been taking my inhalers, and I've been taking this herbal medicine called Travisil. It's an herbal medicine you can buy here at the pharmacy. And I pretty much almost finished the bottle in 1 day or 2 days. So, yeah, it wasn't very effective. So I decided to ask Salah if he would be able to take me to a clinic. So he did. So,
please, Salah, unlock the door and let me go to a clinic.
The whole experience was sort of different, sort of similar, little differences here and there from in Canada, from comparing. But I thought it was going to be really expensive, but with the total for the whole treatment and everything, including the antibiotics, including the medicine, including the visit, everything came out, would have been equivalent to around $33 Canadian. So it was only maybe $8 to get seen at the clinic to see the doctor. So it was so fast. The difference was that it was so fast. It was not that busy. A woman.
So she's saying how it was only $33 and there was no waiting room, waiting a long time. Yes, if you go to the ER here in Canada, you will be waiting a long time. Difference is there are true emergencies, and then there are Chantel emergencies. Chantel emergencies where she doesn't follow up with her primary care doctor, where she doesn't take her medications, where she's basically non-compliant and she expects just to walk into anywhere and be seen right away. Not going to work. The best way to avoid waiting is to keep on top of your own health care. And if you make an appointment, you keep the appointment, and usually it's not long of a wait.
Requested my passport, and so we gave him all the information, and that was pretty much it. Yeah, just with my passport, that alone was, enough to be seen, I guess. I'll insert a little video here. I got a little bit of a video of it just to show you. It was so colorful and so different than, the drabby waiting room I'm used to in the clinics. But I guess just different artwork. I guess some of the clinics in Canada are not that drabby. I shouldn't completely I'm not dissing on it. I'm just comparing.
Sounds like you are dissing it. And she is, I guess, a clinic connoisseur because she, like I said, doesn't keep her own healthcare up, so she's constantly going to walk-in clinics and ERs, and and she's getting the full experience of our drabby waiting rooms. Honestly, I don't care what the waiting room looks like. If it's clean, great. If I'm in pain and sick, I just want my treatment. I don't care. I'm not looking at the decor.
It was so colorful and the seating was very different. So then we went into this room and the doctor was just there direct. So you know how in Canada you go into a waiting room and then you go into another little waiting room and wait for the doctor? Well, the doctor was just there direct. So I sat down and he was like, "Yes, how can I help?"
What does she mean the doctor was just there direct? So she didn't go into a separate room? So how is that good? It sounds to me that she's having a consult with a physician out in the open in the regular waiting room. Listen, I don't know how that's better, but okay.
So, I explained my symptoms to the doctor, and so he then looked at my throat. I actually have a throat infection, which I had no idea about, so he said that could be contributing to the fatigue.
Did you tell the doctor that you have a history of gono in the throat? And that you didn't finish your antibiotics that you were supposed to take when you were diagnosed with that?
Luckily, he did check Salah's throat as well. His throat is fine.
Okay, Salah's throat is fine because they are social distancing. There's no saliva swap there. None of that going on. So of course Salah is okay.
Prescribed me some antibiotics for this. And for the breathing, shortness of breath, and the cough, and the other symptoms, he wanted me to have a rapid test done, a COVID test done, and also to have a nebulizer treatment done. So the nebulizer treatments, he actually prescribed for 3 days and twice a day. So every 12 hours, I have to go back to this clinic and get this nebulizer treatment, which means I'm going to have to go back at 2 in the morning to get this treatment done. But they also gave me a COVID test, which is negative, so I do not have COVID. Just mostly just maybe viral, maybe mixture of the throat infection, viral, and also just really bad asthma. And yeah.
Would the clinic be open at 2 a.m.? I know a hospital would, but a clinic? Usually if it's kind of a wonky time, you go start something at 2 in the afternoon and then you have to do it at 2 a.m., they sometimes just sort of delay the next treatment so it's better in sync, 8 a.m. to 8 p.m.
That actually went a lot smoother than I thought. I was really nervous when I thought, oh no, I'm going to need medical care in a foreign country. It did make me very nervous because, I don't know, I didn't know what to expect. So I was prescribed Zythrone. It's basically azithromycin, and I have to take 1 tablet twice a day. So basically you just cut them in half. I just bite them with my teeth. There's a little groove. Some Panadol, which is Tylenol for fever. Floodrex. I've never heard of this. It's cold and flu stuff. So, lowers temperature, relieves pain and headache, nasal congestion.
Girl, get a little dollar pill cutter for those zithromycin tablets. So I guess that's just like a zip pack. They prescribe it here as well. Quite common for infections. Listen, I'm glad it's nothing serious that the doctor saw. I don't know. Like I said, I'm sure she left a lot of stuff out, so she would just get the antibiotics that she needs to feel better. Good, she doesn't have COVID. Great. But that's it for me for the Foodie Beauty comparison healthcare Canadian system to Kuwaiti system, which she's basically scratched the surface of. I have a feeling this will just be the tip of the iceberg. She's a ticking time bomb. She can't go on forever with her lifestyle, with her weight, with all of her past history, and not need more intensive, extensive care. Thanks, guys. I appreciate it if you made it this far. Bye.